In this forum, I'll be discussing barriers to effective communication and the impact it has on patients, my communication style and the impact that it may have on the success in advanced practice, and the difficulties or possible issues that may come about during provider to provider or provider to patient communication, and which one may be more challenging and why. Some of the barriers to communication may be things such as language. So, whether the patient speaks the language that the provider speaks or vice versa, the ability to speak and understand verbiage and jargon from different places, whether it be in the United States or outside of the United States, and just how certain people communicate. There can also be issues with cultural communication, such as hand gestures in some cultures are rude, but a lot of people, especially women, use hand gestures when they talk, or just the fact that a woman may be speaking with a male about their health care. That can be something culturally that is not accepted in other nations. There's plenty of other options there. Those are just the first two that came to my mind. But cultural really is something that we really have to pay attention to, especially in just the world that we live in today. There's people from all different places, all different backgrounds, all over. So we don't just stay where we were raised. Emotional status. So is the patient emotionally capable of taking in the information that you're speaking? It doesn't have to be bad information that makes them emotional. It could just be the fact that they may have had a bad day, or they may have been upset by someone that they were speaking to or communicating with before they came to your office for their visit. So their emotional is important, that they are calm enough to hear what you're saying, to understand it, and to take it in. Clearly, some things have to be communicated, and people will be emotional when certain things are communicated, but I think it's important that we pay attention to their emotions, and if they're absent because of that from the conversation, or if something else is playing a part there. Medical jargon, I know a lot of those in the medical field are not very good at using other words outside of the words that we know. I definitely am not the best, but a lot of patients, they may act like they know what you're talking about when you use medical jargon, and they may actually have no clue what you're talking about, or vice versa. People may believe that they know what you're saying, but they don't actually understand the terminology that you're using like they think they do, or the patient may just say, I don't know what you're talking about, we're going to have to start over. And then you have patients that don't speak up at all. So you believe that they've left the office or wherever you may be providing care, and that they understand what's going on, and then they have no way of relaying that information to other physicians, to family members, whoever that may be. We also have technology. So technology can be such an asset in the medical community just because of the quickness and the ability to communicate without having all of these loops and hoops to jump through. But there can also be a huge downfall in technology because you can't see the person's face. You can't hear the tone in their voice. You can't see their reactions on their face. Maybe you misinterpret something because you're not able to see those things. And same for someone else, maybe receiving information from you via technology. There's also a large population of people that don't know how to use technology in the way that others do. So someone in Our generation is pretty good at using technology, but we have an older generation that was not raised with technology and they're learning as they go. So I think we also have to remember that when it comes to technology and communication. Physical disability, when I think of physical, I think of patients that may be deaf or blind or have a hard time moving from place to place outside of their regular home. So clearly, if you're deaf or blind, we're going to have to communicate with you, but it's going to probably need to be in a very unconventional way. A lot of people may not have family members that can come or friends or devices that help them to communicate. So that is something that you have to be prepared for within practice. And then distractions. This can be a physical distraction in the room. It can be a mental distraction, an emotional distraction. There's just so many ways that people have so many things on their mind. And when they're in a room with you or wherever you may be meeting with them, you want them to really focus on what you're saying. You want them to hear you so that way they can ask appropriate questions, respond appropriately to things that you're saying, and hopefully understand the care that they are going to receive or may need based on their medical status. Communication is clearly an important part when you're working in the medical field. So when you look at a communication style, it really does tell you the type of success you may be able to have based on the ways that you communicate. Doing this communication quiz showed me some areas where I really need to hone in on how I communicate. Not that you wouldn't be a good practitioner if you can't communicate, but it would certainly hinder your practice and the relationship that you have with your patients and your coworkers. So if you have more of an open communication where you are honest with your patients, but yet you're empathetic with them, you sympathize with how they're reacting to what you're saying, and then they know that you can be trusted. They know that they can come to you, that they can be honest with you about if they take their medicines or not, or if they work out or drink or do drugs or anything of that nature. They know by how you communicate with them, the tone of your voice, the look on your face, your body language, how you're going to react when they tell you something that they know is not appropriate for their medical condition, but yet they do it anyway, whether it be a habit or just something they do because it's their thing. So I think communication clearly can build a great rapport and trust between you and your patients that you take care of. On this same aspect, an inability to communicate or communicating negatively to things that patients tell you come back, but you may see where patients don't continue to come back or they don't tell you everything that would be important for you to know about their care. And of course, anytime you're working in an office or a hospital, your communication with your coworkers and physicians, nurses, social work, all of that is so important because it is one little piece of the patient's care. And of course, if you're missing a piece, then that could lead you down or lead others down a road that is not effective for the patient. It may increase their time that they're waiting. It may increase their time that they're admitted. It could be detrimental to their health as well. So communication is so important. And knowing your communication style and what you could work on, what you could be better with is absolutely critical. As far as provider to provider or provider to patient communication, which may be more challenging, I think there's pros and cons to both. I think that you have some providers, specifically doctors, that don't like APRNs or FNPs, whatever you'd like to call them, they would just rather not deal with that. They would rather deal with someone more on their same playing level per se. And then you have some that are really accepting, and they want you to learn, and they want you to be a good provider, and so they kind of take you under their wing, and they show you the ropes. So whereas I think there's some that would be extremely easy to communicate with because you have created that relationship where you know that they have your best interests in mind as well as the patient's best interest. But I think you also have those that don't really care. They think you're more of a bother, or you don't know enough. So that's my take on provider to provider. Provider to patient is also the same way. There's pros and cons. You have patients who don't trust you because you're an FNP or an APRN rather than a doctor, or they may second guess everything you say. Maybe they've had a bad experience or their family's had a bad experience, and so there's just so much in their mind to go through. But then you also have those patients that are just looking for someone to listen to them and to notice the work that they're putting into their health and things of that nature. And you're able to sit and be honest and explain, and they listen. And I think that sounds like a golden world, but I do believe those patients are out there. So I think both have pros and cons. For me, I believe personally at this point in this stage of my life, it is a little easier to speak to the patient rather than to another provider, just because it's easy to get that friendly feel where you can talk and just know that the conversation will flow based on whatever you're speaking on. So that is my take on communication and effective communication and how it affects practice as an APRN.